Addiction remains as the #1 cause of death for people under 50 years old. And we often fall on understanding addiction as a moral problem, a criminal problem, a social problem. The strongest form of stigma against addiction is the failure to understand that it is a disease. And in fact, it is a disease of the brain that's highly connected with mental illness that can be treated through professional care and supported by health insurance. Introduction to Addiction Psychiatry is a tour de force in integration. What we're doing in this book is integrating mental health and addictionology as one type of practice called addiction psychiatry. Addiction psychiatry is a field of medicine and psychiatry where doctors are trained to treat both mental illness and drug addiction, integrating neuroscience of addiction and mental illness, as well as the clinical care and clinical practice of these integrated diseases. As part of that integration, we're also translating what we know about the neuroscience of addiction, vulnerability, and mental illness to the levels of clinical practice and clinical training. It turns out that the brain substrates that give rise to mental illness also change an individual's threshold to acquiring addiction. Mental illnesses render the brain involuntarily more vulnerable to a drug addiction. And then when folks with mental illness acquire drug addiction, it tends to be the case that the addiction will rebound to worsen the underlying mental illness. So addiction psychiatry is really a clinical field that's informed by our neuroscientific understanding of the integration of these disease processes.
Here at Indiana University, we have integrated with 2 community mental health centers trying to improve the outcomes of these particular patients.
Our team has been partnered with Dr. Chambers and IU Addiction Psychiatry so that we are building in that perspective into all of our team staffings and really making that part of the fabric of our addiction services.
The clinical care of patients with mental illness and drug addiction really is a team sport. So the book is also achieving a pathway by which doctors, nurses, and therapists can work on integrative, multidisciplinary teams to treat patients with dual diagnosis disorders.
There's a lot of ways that Aspire can benefit from the introduction of this book into our practices. One thing that we've already seen as we've piloted the interdisciplinary team staffing in the book has really been just massively beneficial so far. We've been doing it for a few months now, but we actually plan to roll it out to all of our teams in all of our locations moving forward.
It is a textbook of addictionology, certainly, but the book is really designed to help us build the field and to present much more of a united understanding of addiction and the way addiction is connected with mental illness.
Compassion leads and innovation follows. This is an innovative approach that's really going to benefit the folks that we serve in our communities. I'm really hopeful and optimistic about the assimilation of this content to the work that we're doing at Aspire, how that can flourish and how our teams grow through this process.
Intro to Addiction Psychiatry really is a field-defining textbook that we've really been working on for about 10 years. In each of the 5 chapters, we are working to define addiction as a brain disease. In Chapter 1, we talk about the epidemiology of addiction. In Chapter 2, we talk about the symptoms of addiction. In Chapter 3, we talk about the anatomy and the neurobiology involved in addiction disease in the brain. In Chapter 4, we do more neuroscience and describe the connection between mental illness, adolescent neurodevelopment, and addiction disease and pathogenesis. Finally, in Chapter 5, we talk about how we go about diagnosing the disease, how we treat it, and how we integrate different treatments to help people along recovery trajectories.
We plan to implement Introduction to Addiction Psychiatry by recommending it to the residents during their Addiction Psychiatry didactic series. We're trying to get medical students engaged in the field of addiction psychiatry, and this book is a key component in doing that. The ultimate goal is that this improves recruitment into the Addiction Psychiatry Fellowship here at Indiana University.
The Indiana University Addiction Psychiatry program really has done a great deal of work in understanding the biology that connects mental illness and drug addiction, which is essentially the neuroscience of addiction psychiatry.
I think one of the biggest strengths about this program And why I care so much about this program is that teaching is a really important part of our fellowship. You need to be able to teach your colleagues about addiction psychiatry. As you move forward, you're going to be a leader in the field once you're board certified in addiction psychiatry. We practice teaching residents as well as other healthcare workers about our approach to dual diagnosis treatment. And my passion is expanding the field. I love these patients, I love this field, and so the Introduction to Addiction Psychiatry book serves as an introduction book to expand the field of addiction psychiatry.
The book's now been published. It is available on Amazon, Barnes & Noble, and of course from the publisher, Cambridge University Press.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.